Patients with atrial fibrillation often require anticoagulation and platelet inhibition as a combination, but there are limited data on the bleeding risk of combination therapy. Now in the archives of internal medicine, researchers report on using Danish registries to identify almost 83,000 patients hospitalized for first-time AF and their post-hospital therapy of warfarin, aspirin, clopidogrel, or combinations of these drugs. The researchers then tabulated risks of non-fatal and fatal bleeding. During a mean follow-up of 3 1/3 years, 11.4% of patients experienced a non-fatal or fatal bleed. The crude incidence rate for bleeding was highest for dual clopidogrel and warfarin therapy at 14% per patient year, and triple therapy at an even higher 16% per patient year. Using warfarin monotherapy as a reference, the hazard ratio for aspirin alone was slightly less than 1, and for clopidogrel alone was slightly more than 1. Combinations of aspirin and clopidogrel, warfarin and aspirin, and warfarin and clopidogrel had increasing risks of bleeding respectively. Not unexpectedly, triple therapy with aspirin, warfarin, and clopidogrel had the highest relative risk at almost 4. The researchers conclude that in patients with AF, all combinations of warfarin, aspirin, and clopidogrel are associated with increased risk of non-fatal and fatal bleeding. Dual warfarin and clopidogrel therapy and triple therapy carried a more than 3-fold higher risk than did warfarin monotherapy. I'm Peter Block with a CardioSource Heart Minute.